yangu ni machache sana. Mengi yamesemwa. I'd like to back up everything that has been said here. Partnerships. The county government of Nakuru, under the leadership of Her Excellency the Governor, Susan Kihika, appreciates partnerships. We cannot fight this disease without partnership. So we acknowledge the national government, represented here by the Deputy County Commissioner. We acknowledge the members of the County Assembly and the entire County Assembly of Nakuru. We have Mheshimiwa Nebuki, yes, MCA for Soin. We are expecting the area MCA, Mheshimiwa Fadhili, and we believe that in partnership between the executive and the legislature, we will fight this disease. We acknowledge the partnership of communities that has been described here, and all the community representative organizations and institutions that we know about. We appreciate the sacrifices that you are making. We acknowledge the partnership with the development partners, which Chief Officer is so carefully acknowledged. We don't take it for granted. We hope you will work with us towards that goal of zero. The community representative said zero positive, what did he say? New infections. So we support that goal. I wish to ask the MCA for Soin to just stand up and say hello.
Our CS, our CEC, the two CEOs, and all partners, good evening. I am Honorable Digon Naburuki from Soin Ward. Thank you.
Asante sana. I should also acknowledge the leadership of our facilities, represented here for the candle lighting ceremony by the Medical Superintendent Bondeni. Doc, I saw you. She's over there. That is Dr. Yatol. She oversees our facility at Bondeni. Thank you very much, Doc, on behalf of all the leadership of our facilities. Without further ado, may I introduce to you our County Secretary and Head of the Public Service, Dr. Mwaura, to speak to us. He's not only our County Secretary, he's also from the medical profession, together with Dr. Murima. So when he speaks, he'll be speaking with authority, not just from the political angle or from the administrative angle, but also from the technical angle. Dr. Mwaura, please.
Colleagues from the Department of Health, including the management team, colleagues from the county government, esteemed guests, partners, our community members, Woolmart management, ladies and gentlemen. I join on behalf of Her Excellency the Governor of Nakuru, Her Excellency Governor Susan Kihika, to commemorate the World AIDS Day, which the world will mark tomorrow, the 1st of December 2023. Our candlelight ceremony presents us an opportunity to pause and reflect on our personal and community journey with HIV and AIDS. We dedicate this evening to all our community champions who have played a significant role in combating HIV and AIDS. The impact of HIV and AIDS in our society is undeniable, touching the lives of individuals, families, and communities. It has tested our resilience, compassion, and commitment to the well-being of our fellow citizens. May this candle symbolize the beacon of hope that our county will cover the milestones in combating HIV and AIDS. Under the leadership of Her Excellency the Governor Susan Kihika, Nakuru has increased the access to healthcare. New infections have decreased from 1,332 in 2021 to 1,109 in 2022. We have reached out to 45,755 individuals living with HIV, providing them with care and treatment out of an estimated 57,635. The candles we light today signifies our commitment to the remaining 11,880 individuals, ensuring that no one will be left behind. As we come together in solidarity to let us remember that our fight against HIV and AIDS is ongoing. It requires continued collaboration, awareness, and steadfast dedication. The candles we are lighting today not only represent our past, but also guides us towards our future, where the impact of HIV and AIDS will be diminished. Let this event be a reminder of our shared responsibility to support one another, eliminate the stigma, and work tirelessly until we achieve a world free from challenges posed by HIV and AIDS. On behalf of Her Excellency the Governor, I want to assure the residents of Nakuru County of the accessibility of quality health services in our community and health facilities. With these remarks, ladies and gentlemen, it has been full of experiments, frustrations, and successes. It has been brutal to some. It has ended up for some well for some, and some have fallen along the way. I want to say that as a country, Kenya, we have been in the front line of research, both the medical research and social sciences research towards combating this disease. And we cannot forget some very important partners in this journey. UTJ, I know you have evolved over time. As we are combating this, we have moved from Afya Plus, Afya Bonde La Ufa and all that. That shows that the journey of evolution of this disease, we have our partners. I think you said now you 30-something years, if you, or 40-something, I don't know. But it shows the journey that we have gone through. We have gone through a lot of experiments in the community. Nani anakumbuka ile story ule mtu wa Uganda, Tanzania, mmoja alikuwa anaitwa nani? Loliondo. Now, I used to work in the Naivasha HIV clinic when Loliondo story happened. And what used to happen, this is an experiment that we were doing as a country. Our people are doing an experiment. And I think we learned a lot from it. Because we would walk up to our clinic and find no patients. And those guys were very crafty. You know, these people who are, we even had agents who are transporting patients there. They were coming to fish them in our clinics. We make up on that, unaona wagonjwa, pale nje wanachukuliwa kupelekwa Loliondo. It was a very bad social experiment, but our people learned from that bad experiment because we lost some people. But the most important thing is that as a nation we are resilient, we learned, and I don't think we will ever do such an experiment again. We have had so many heroes who have fallen along the way. I want to take this opportunity to recognize one of our great soldiers. I think you all remember the late Dr. Babu. He was a soldier, he was in the front line, and we remember him as we celebrate this because he's one of the biggest contributors to the research and the success that we have had in this battle of prevention of HIV and AIDS. We have had very many stories of maps. We have slept several times with some of these healthcare workers in Kikope, in Gilgil, in Naivasha, trying to do this work. And therefore I also want to take this opportunity to celebrate the healthcare workers who are still fighting, who are still soldiering on. I want to encourage you. I know the journey of 1990, it was in 2020. It was a very brutal battle for some towards the end. I know we have some staff work with who employed or paid for by UTJ. I know it was a very bad and brutal experience for them, but those are soldiers who are at battle and were able to beat that deadline. I know the Ministry of Health, the Department of Health, even the GOK staff have been involved heavily, from clinical care to management to all these things. So we celebrate all of you. And as we fight the remaining bit of this journey, we have shown that we can succeed as a nation, we have shown that we are resilient. Mine is to encourage all the healthcare workers, the community members, patients, mental mothers, and all those people in this sector, our partners also. Let's win the remaining part of this battle. Let's, by that date, that year which has been said, which is 2030, it should no longer be a public health concern. Let's work hard to meet our target.